Intra-abdominal vascular anatomy is very challenging for a lot of people, including myself. So we're going to take our time and we're going to go through the named blood vessels of the abdomen here, starting below the diaphragm at the celiac trunk, okay? So this is your celiac trunk, and what are the vessels that come off of the celiac trunk? There's three. All right, good. Splenic artery here, okay? Left gastric, and then common hepatic, okay? So we're gonna take our time. Celiac trunk, splenic artery, left gastric, common hepatic. So then common hepatic is gonna branch into the proper hepatic and the GDA, okay? The GDA is the gastroduodenal artery, and that's where things get exceedingly tricky. However, let's keep going here. So the proper hepatic is then also going to branch into a right and a left hepatic and a left hepatic. So important to note is that the cystic artery to the gallbladder comes off of the right hepatic, okay? So we're doing pretty good in the upper abdomen here so far. So the GDA is then going to turn into the superior pancreatico-duodenal, which has both an anterior and posterior branch, because that vessel is literally sitting on the head of the pancreas. So the gastroduodenal artery, which was a branch from the common hepatic, turns into the superior pancreatico-duodenal, which has an anterior and a posterior branch, okay? So if there's a superior pancreatico-duodenal, you better believe that there is an inferior pancreatico-duodenal with also a anterior and posterior branch, and that is going to come from the superior mesenteric artery, which is the next large truncated vessel coming off of the intra-abdominal aorta. Over here we have our renal vessels, the left renal and the right renal going to the kidney, okay? Now, our SMA, so comes down over to here to the right lower quadrant with the ileocolic, and then guess what the ileocolic gives off? Well, the appendiceal, okay? So that's coming down here. There are jejunal branches, getting your jejunum here, okay? And then there is a right colic, and then to the transverse colon, there is a middle colic. So keep this super simple, guys. Right colon, right colic. Ileum, ileocolic, appendiceal comes off. Very easy. And you have branching jejunals. So we take those all with a large jaw end seal device. So watch my video on staplers and energy devices, okay? Then we have the IMA over here. So the IMA is going to get the left colon. So the left colic. Then what part of the colon's coming down over here? Easy. You're going to have a sigmoidal branch. Perfect. And then you get to your rectum down here, and it gives off a superior rectal. Okay? So that is the important named vessels to the intra-abdominal organs, and the splenic over here also gives off the short gastrics as well. And then over here, you're going to have a right gastric as well, and your gastroepiploics on the greater curve of the stomach here as well, okay? So this confluence of celiac and SMA, I think, is where the vasculature anatomy gets the most tricky. So really study that portion. The rest, again, just think where it's going to, and you got the name. It's a lot simpler than you think when you just step back for a second and think about the anatomy. Everything is named for a reason, and it'll get you there. So great job, guys.